Hi guys, Chris here again. I'm with Dr. Bock again from Colorado Mountain Medical. And we wanted to explain some confusion that we're seeing out in the community. And an example is the headline today, antibody testing scarcity. And what we really want to talk about is what is the antibody test, or also called the serology test, versus the test that we have readily available in our community. So Dr. Bock, can you tell us a little bit about what this antibody test is and how it works?
Let me begin with the PCR testing, which is what we've been using since the onset of the COVID pandemic here in Eagle County. The PCR testing stands for polymerase chain reaction.
I'm glad you said it, not me.
It's a test for an antigen, a viral antigen, the coronavirus antigen, and it's genetically based. It tests RNA, and it's obtained by placing a swab into the nose and obtaining a specimen from deep within the nasopharyngeal passage, putting that in media, and then sending it to a testing facility. Generally, we've been sending it to a commercial laboratory, and we get results 24 to 48 hours. Very recently, actually the beginning of this week, we've had the ability with a limited number of testing kits to test patients with PCR testing from the emergency department, the inpatient environment, or our employees. And the turnaround, once that's placed on the machine, which is based here in the hospital, is 45 minutes. So that's a wonderful addition, but it's only very recently that we've had that.
Quick question, I just wanted for clarification. So if you're sick with COVID-19, our test today can detect it for you.
In fact, that's exactly what that test does. The antigen shows that you've got the virus.
Great.
And that you may be asymptomatic because the virus can be in you and not producing symptoms, or you may be very early on in the disease and having very mild to no symptoms, but you've got the virus. Yes, that's what it tests for.
So the take-home message before we jump to the other type of test is, since March 4th, we have been able to test for this in our community, and we've been testing 7 days a week in our community, and we have more than enough capacity to continue testing anybody that wants to get tested or is sick and should get tested.
Absolutely. We've actually tested in our community well over 2,000 individuals during that period of time. Now, the antibody testing, which is not as yet available in our community to Vail Health or to Colorado Mountain Medical, but is likely coming. When it will be coming is not true, is a blood test. And it tests for the antibody. Our bodies, when we get ill from an infectious disease, create antibodies to combat that infection. And the antibody test tests for that antibody in our blood. So you obtain a blood specimen, you take that blood specimen to the laboratory. The laboratory has a little testing strip. You place the blood on the testing strip with the appropriate solution, the diluent that's added, and 15 to 20 minutes later, you have a result as to whether there is antibody in your blood, whether you have at some point in time been infected by the virus and you now have antibodies. The interesting thing is, we don't know how long those antibodies will hang around. They may hang around for a long period of time. They may hang around only for several months. We don't know that as yet. There's not been enough information able to be collected to provide us that. So what that will tell us is that you have been infected, but it won't necessarily tell you at that moment in time that you are infected.
Right. And in follow-up to that, it won't necessarily also tell you if you're susceptible of being infected again, because we don't know. right?
We don't know that. That's the interesting thing. There are individuals who have clearly been infected twice. We don't understand everything about that. Is that because the virus has mutated? Is that because the virus the antibody is shed fairly quickly and you get infected by the same virus again? We just don't know that. That's information we'll get as time goes on.
So what we wanted you guys to know is we have a great testing system in place. We have a great test that we get the results back in 24 to 48 hours. It's available throughout the entire valley, and there should be no one thinking at home that there's any limited resources here in this community around testing, or that anybody shouldn't be tested if they feel they need to be tested.
Absolutely correct, Chris.
Thank you.